Hello friends, we are back with a new episode, and today we will talk about disease and history. Yeah, disease is as old as human history itself. There are many famous scientists who have dedicated their lives to research and study of the disease, so that we can live a happier and healthier life. But before all this, in ancient times, people didn't know about germs or viruses. They had no idea how the diseases spread. So they used to think that bad air or foul air was causing them diseases like tuberculosis and cholera. That's why people used to stay away from crowded areas, which reduced the chances of getting infected. Since the plague is spread by fleas that live on rats, it's important to practice good hygiene and keep our surroundings clean. It can be life-threatening if left untreated. Vibrio cholerae is a bacterium that causes cholera. It's usually found in water and food that has been contaminated with feces from an infected person. It mainly affects the skin, peripheral nerves, upper respiratory tract, and eyes. Leprosy is spread through armadillos, droplets from the nose and saliva of an infected person, in contact with infected animals. It is caused by Salmonella typhibacteria and is spread through contaminated food and water. The virus that causes yellow fever is called It is found in tropical and subtropical regions of Africa and South America. The incubation period of yellow fever is usually 3 to 6 days. I hope you found this video informative. If you like this video, don't forget to like and subscribe for more updates. Thank you and take care. Symptoms of yellow fever include fever, headache, chills, muscle pain, nausea, vomiting, and jaundice. In severe cases, it can cause bleeding, organ failure, and shock. Vaccines are available to prevent yellow fever. It is recommended that travelers to endemic areas get vaccinated. To protect yourself from yellow fever, use insect repellent, wear long-sleeve shirts and pants when outdoors, and avoid mosquito-infested areas. The symptoms of typhoid include high fever, weakness, headache, constipation or diarrhea, stomach pain, and rose spots on the chest. It is spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. COVID-19 can cause mild to severe respiratory illness. The symptoms of COVID include fever, cough, fatigue, shortness of breath, loss of taste or smell, sore throat, headache, muscle or body aches, nausea, diarrhea, and rashes. In severe cases, it can cause pneumonia, acute respiratory distress syndrome, and multi-organ failure. COVID-19 can be diagnosed through a test called PCR or antigen test. Vaccines and antiviral medications are available to prevent and treat COVID-19. It is important to follow preventive measures such as wearing masks, maintaining social distancing, and washing hands thoroughly to prevent the spread of COVID-19. Typhoid can be diagnosed through a blood test or a stool culture. It can be treated with antibiotics such as ceftriaxone. Vaccines are available to prevent typhoid. People traveling to endemic areas or those who have been in contact with someone who has typhoid should consider getting vaccinated. To protect yourself from typhoid, always wash your hands thoroughly before handling food, drink only safe water, avoid uncooked or undercooked food, especially meat and poultry, and practice safe food storage. The symptoms of leprosy include skin lesions, nerve damage, paralysis, blindness, and disfigurement. Leprosy is a slow-growing bacteria, so the symptoms may not show up for several weeks or months. Leprosy is curable with a combination of antibiotics. Early diagnosis and treatment are important to prevent disability. The major symptoms of cholera are profuse, watery, diarrhea, and vomit. Diarrhea is a condition in which the stools are loose and watery. It is usually a symptom of an underlying condition rather than a disease itself. It can be acute or chronic. Acute diarrhea is usually caused by a viral infection and lasts for a few days. Chronic diarrhea can be caused by a number of conditions, including irritable bowel syndrome, Crohn's disease, and celiac disease. The symptoms of diarrhea include frequent, loose, watery stools. This can lead to dehydration and malnutrition. To prevent diarrhea, practice good hygiene, wash your hands thoroughly before eating, drink only safe water, avoid uncooked or undercooked food, and use proper food storage techniques. These symptoms can lead to rapid dehydration and can even be fatal within a few hours. If treatment is not provided on time, to protect yourself from cholera, make sure you drink only safe water. You can do this by boiling water, using a water filter, or using disinfectants such as chlorine or iodine tablets. Always wash your hands thoroughly before eating and after using the toilet. If you are traveling to an area where cholera is common, make sure that you take extra precautions to keep yourself safe. Consult your doctor about getting vaccinated against cholera before traveling abroad. This helps to control the rat population and prevent the spread of fleas. We should also avoid contact with wild or stray animals, especially rodents. If you find any dead animal, report it to the local animal control authorities right away. Make sure that you wear protective clothing when you are around sick animals. If you notice any symptoms of the plague, seek medical attention immediately. The oldest known record of someone trying to understand the disease was done by Hippocrates, who was born in 400 BC in Greece. He is considered to be the father of medicine. It was one of the most feared diseases throughout human history. The smallpox virus enters the body through the respiratory tract and then spreads to the bloodstream. It then erupts on the skin as painful, fluid-filled blisters. These blisters turn into pustules and then scabs that later fall off. The incubation period of smallpox is about 12 days, but it can range from 7 to 17 days. During this time, the virus multiplies in the body and the person shows no symptoms. Once the symptoms start showing, the disease lasts for 2 to 4 weeks. Fever, headache, vomiting, rash and weakness are some of the symptoms of smallpox. Smallpox can be very serious and even fatal in some cases, and those who survive may suffer permanent disabilities due to. The good news is that smallpox has been completely eradicated from the earth. This was made possible by a global vaccination campaign led by the World Health Organization. He is also considered to be the father of surgery. His work, which was completed around 800 BC, was translated into Arabic during the 8th century. In his book, he explains how to treat diseases along with various surgical procedures. He even described more than 300 different illnesses and their treatments. He explained that many diseases were caused due to imbalance of 4 humors in our body, which are yellow and black bile, phlegm and blood. According to him, an individual can be healthy only when these 4 humors are in balance. In India, there was a great sage named Su. Let us now travel back in time and learn about some dreadful diseases that have plagued humanity since ancient times till date. Number 1. Plague. The plague is one of the most dreaded diseases throughout human history. It has killed millions of people worldwide. Do you know what causes the plague? Yersinia pestis, a bacterium that is usually found in rodents, is the main cause of the plague. This bacterium is primarily transmitted through fleas that live on these rodents. One of the most notable outbreaks of bubonic plague occurred in Europe during the 14th century. This came to be known as the Black Death. It is estimated that at least 25 million people lost their lives during this plague. Some of the symptoms of the plague include fever, chills, weakness, swollen lymph nodes, buboes, which is a painful swelling in the groin, armpits, or neck. If left untreated, the plague can quickly become fatal. Now, let us see how we can protect ourselves against the plague. Number 2. Cholera. Cholera is an infectious bacterial disease that causes severe diarrhea and dehydration. Number 3. Smallpox. Smallpox is a highly contagious viral disease that causes fever, rash, and pain. No. 4. Leprosy. Leprosy, also known as Hansen's disease, is a chronic infectious disease caused by the bacteria Mycobacterium leprae. Number 5. Diarrhea. Number 6. Typhoid. Typhoid is a serious bacterial infection that can lead to high fever, diarrhea, and abdominal pain. 7. Yellow fever. Yellow fever is a viral infection that causes fever, jaundice, and bleeding. It is spread through the bite of an infected mosquito. 8. Covid-19. Covid-19 is an infectious disease caused by a virus called SARS-CoV-2. So these are some of the dreadful diseases that have plagued humanity since ancient times till date.